Hello friends, as a practicing cardiologist, one of the challenges for me is to know what's happening to the patient's heart rate, rhythm, ECG, blood pressure when he's away from me. Today we're going to discuss what is monitoring, how as doctors we do this kind of monitoring of heart rate and blood pressure. Cardiology, to use a cliche, is a pulsating branch. The action of the heart is relentless. It's about 70 per minute into 60 in 1 hour, into 24 in a day, into 365 in a year. And in a span of 375 years, the number is so vast that the calculator screen is inadequate. The fascination for cardiologists is to monitor the heart and its activity throughout the day or 24/7. Typically, a person complains of a rapid heart rate or a palpitation or dizziness or graying in front of the eyes at night. When he reports to you next day morning, the examination and every aspect of the examination is completely normal. And in such situations, when the complaint which happens away from the doctor or is not recorded is always a curiosity. Monitoring of heart rhythm, monitoring of blood pressure, and other aspects of cardiology has been in development throughout. Now, it has reached to a best of its ability with the modern day techniques, gadgets, and of course, artificial intelligence. Such a monitoring helps the treating doctor make a correct diagnosis and make the treatment more precise. The onus is no longer on the patient to remember what time of the day it happened, what happened, how long did it last. It all gets recorded if you are monitoring the patient well. The commonest monitoring is the heart activity or the rhythm of the heart. You must have seen in the ECGs, a person is connected to a cardiac monitor through wires, and the ECG is continuously running. The heart rhythm is stored in the monitor for nearly 24 hours, and one can go backwards and see what rhythm was at 3 a.m. or 4 a.m. and so on. If the heart becomes very slow or very fast, it can be picked up and accordingly the treatment can be offered. Old monitoring techniques required a central monitor that was manned by a trained personnel. The next stage of monitoring is a Holter monitoring. In this, ECG recording monitor is tied to the patient's body and there are wires connected to the device. And the device keeps recording the ECG all the time. With this device, the person moves out of the doctor's clinic, goes for a walk, does normal activities, goes to office, drives a car, and that's why it's known as an ambulatory Holter monitoring. That is, while the patient is moving around or is ambulating. After 24 hours, the device is returned to the doctor's office, and when connected to a monitor through various softwares, one can see the display of the entire 24 hours. One can make out what the abnormality was, what was the average heart rate, what was the fastest heart rate, what was the slowest heart rate, and if there were any abnormal beats or missed beats or dropped beats. All this is termed as arrhythmia, which means the normal rhythm of the heart is disturbed. 24-hour ECG Holter monitoring yields a significant information, but still it can be inadequate. One wishes to have a larger monitoring of the ECG in order to get a better yield of the patient's symptoms. This leads to a 7-day monitor, but it will be too cumbersome for the individual to move around with a wired device on the body without taking a bath and other discomforts. And that's why wireless devices have come into existence. The modern day wireless device is like a pen drive. It is stuck on the patient's skin, there are no wires, and the person moves around, takes a bath, goes to office, does normal activity, in fact can play tennis while the monitor is on. Such a device can be worn for 7 days or 15 days or a month also. In this, abnormality related to the heart rhythms are brought out very well. The yield or the information obtained from this leads to a diagnosis which is very, very accurate. The rhythm called atrial fibrillation is nowadays making rounds. AF or atrial fibrillation is an abnormal rhythm of the heart where the upper compartments or the atria go into a fast rhythm, and in this period the person gets palpitation. It can remain completely silent or it could be very explosive. Unfortunately, because of the abnormal contractions of the atria, there is stagnation of the blood causing a clot in the atria, and this clot then can travel to the brain causing a stroke or a paralysis. So many atrial fibrillation patients are found when they present to us with a stroke or a paralysis. There is a clinical situation so many times that the person is presented to you with a paralysis and absolutely nothing or no cause is found because all his investigations done are completely normal. For such a stroke or paralysis which is not related to obvious causes, a 7-day and a 15-day or a 1-month Holter monitoring will bring about intermittent atrial fibrillation. And once it is diagnosed, the cause is identified and the treatment can then be very simple. In order to diagnose arrhythmias which are even more silent or let's say very infrequent, loop recorders are available. And in this, a small device is placed inside the skin by a small surgery. And it stays there maybe for a period of months or a year and picks up the abnormality. And of course, it reports back through the AI. While the ECG is getting monitored by this device, it is humanly impossible for someone to keep looking at the ECG all the time. And this job is done by artificial intelligence. The accuracy of interpretation of AI is very high because of the amount of information that is already stored inside, and a correct diagnosis can be arrived at. The AI has information fed related to types of heart rhythm, ECG forms, and the AI picks up and presents this abnormality at the end of the study or as an alarm in between. Smartwatches are now available for ECG rhythms, especially atrial fibrillation. And a person wearing this watch can get an alarm if there is AF. The ECG on the smartwatches is fairly crude, but it serves the purpose when the rhythm is gross and abnormal. Another monitoring that is required by us doctors is blood pressure monitoring. This is also known as ambulatory blood pressure monitoring. See, what happens is in a doctor's clinic or doctor's office, so many times the blood pressure tends to be recorded high. It is known as a white coat phenomenon. And at home, this person's blood pressure can be completely normal. And there are some individuals who feel very comfortable in the doctor's office and feel assured. For them, the office blood pressure is normal, and at home, because of the home stresses, it is high. This is known as a masked hypertension. In order to bring out this white coat phenomena and masked hypertension, ambulatory blood pressure monitoring devices are used. This device has to be worn on the body, and the device is programmed to record the blood pressure of that individual for about 40 to 60 times in 24 hours. It records blood pressure during sleep, during walk, during other activities. It gives a nighttime recording, a daytime recording, and of course the average readings. This kind of an ambulatory blood pressure monitoring helps us know how much control of blood pressure is achieved by the treatment that is offered, or whether the person is really hypertensive or not. Normally, there is night dipping. That means the night average is about 20% lower than the day average due to sleep. But if the dipping is not achieved, which means the arteries are hard and contracted, and this needs to be treated with medication. Ambulatory blood pressure monitoring has brought in tremendous amount of scientific data related to blood pressure, and this understanding has led to a highly correct blood pressure treatment. A peep in future tells us that all of us would be wearing a specialized vest. This vest will have all kinds of sensors on it. It will record heart rate, rhythm, blood pressure, sugar, sodium, potassium, and the works. All this data would be in iCloud and being interpreted and watched by AI. Wow, we are moving into high-tech monitoring in the future. Technically correct, non-emotional management is now possible. I don't know whether these are happier times.